Thank you for joining us for this community briefing. Joining me once again is interpreter Margie Propp, and thank you, Margie, for providing your services and making this briefing more accessible. We encourage everyone to visit our website at covid19.lincoln.ne.gov, where we have a dashboard with the latest COVID-19 data. We update that dashboard at about this time every day, and there you will also find our COVID-19 risk dial, a color-coded tool that provides our community with an understanding of the level of risk of spread of COVID-19 in Lincoln and Lancaster County. On Friday, we moved backwards into the orange range of the risk dial, orange range indicating a high risk of spread in our community. Today in Lincoln, an additional 44 individuals have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 2,226. Our total recoveries identified to date are up from 756 to 785. Today, Scott Holmes is here from our health department. Scott is the manager of the Environmental Public Health Division, and he's going to provide an update on our indicators. Over to you, Scott.
Thank you, Mayor. On Sunday, we had 68 new cases of COVID-19 reported in our community. That's the third highest daily count we have had yet. Yesterday, another 53 cases were reported. And as the mayor said, we have 44 new cases today. That's a 3-day total of 165 cases in Lancaster County. The rise in new cases has not just been limited to the past few days. For the week ending Saturday, July 11th, we had 230 cases reported. That is the highest weekly total since the week of May 17th through the 23rd. The weekly positivity rate has also been on the rise, from 3.1% in the end of June to about 7.5% this past week. Our overall positivity rate remains around 6.6%. Again, the number of individuals under 40 age group who are testing positive continues to be a major concern. In fact, individuals in the 20 to 29 age group make up about 18.5% of our population. But in the last 2 weeks, 57% of the new cases have been individuals in that age group. An area of strength in our community is the hospital capacity. But since the beginning of July, we have seen an increase in the number of COVID-19 patients hospitalized. Today, the hospitals report 21 COVID-19 patients. This is up from just 9 on July 3rd. Today's patients include 11 from Lancaster County residents and 10 from other communities. The increase in case numbers, positivity rate, and hospitalization tell us very clearly that COVID-19 is again spreading widely across Lincoln. And when we look at who is getting sick, it is young adults, ages 21 to 26, who often report going to bars, partying with friends, and hanging out in groups. Very few are wearing face coverings. In other words, we have many young adults who've returned to, quote, normal behavior. Unfortunately, we are not in normal times. This virus loves a crowd, and this behavior is creating a swell of COVID-19 cases in our community. This swell in cases will continue to wash through our community as their friends, younger siblings, parents, and grandparents are exposed and get sick over the next several weeks. These behaviors have pushed our community backward, as the mayor mentioned, and have returned us to the high-risk level on the COVID-19 risk dial. That means we must once again look at the tools that have proven to be more effective in preventing the spread of COVID-19. Those tools include restricting gathering sizes, reducing capacity or even closing bars, revising requirements for sports, and requiring masks to be worn while inside publicly accessible places in most workplaces. To keep our community safe, we're considering specific actions to take in the coming days and weeks. Today we are delivering letters to bars to make it clear what is expected and required by law in our local directed health measures. The letter also makes it clear that if local laws are not being followed, the health director will take immediate closure action under the authority given to her in the local ordinance. Before I turn this back to the mayor, I do want to mention that testing and contact tracing are extremely important tools in stopping the spread of COVID-19. Unlike many communities, testing is now available in Lancaster County for anyone who wants it. You can get started by a simple online risk assessment at chihealth.com or bryanhealth.com or testnebraska.com. Test Nebraska is in Lincoln 4 days this week. Testing wraps up today at 4, but they will be back at North Star Wednesday through Friday. And that testing is open to all Lancaster County residents, even those with no symptoms. All the testing is by appointment only. If you're a young person who has put yourself at risk, the best thing you can do now to protect your loved ones is to get tested and to isolate yourself. Mayor?
Thank you, Scott. We know that our message today is difficult to hear. Yet as public officials, particularly those charged with protecting the public's health, our job is to do what is best for our community, even when it's difficult. We would love to move beyond the need for public health restrictions in our community. We all want to get out and enjoy the summer with others. We all want to see students go back to school this fall. We all want to tell our kids that, yes, you can hang out with your friends. Unfortunately, the progress we have made through shared sacrifice is now being reversed. We are in a very serious situation here. Our public health emergency is not over. I have instructed our health team to determine what measures are necessary to get us back on track, because the setback we are seeing now threatens the opening of school. It threatens the businesses that have reopened, and it threatens the health of every person in our community. We don't want Lincoln to become the next Miami or Houston or Phoenix. We have to respect a virus that spreads exponentially. We must come together as a community to protect one another before things in Lincoln get as bad as Miami, Houston, or Phoenix. This virus doesn't play favorites. There's no Lincoln exemption to the coronavirus. What we do have in Lincoln is a head start. And what we see happening in Miami and Houston and Phoenix is something we can act now to avoid. We can act now to prevent this virus from spreading like wildfire here in our backyard. As we see our progress over the last few months begin to erode, it is up to all of us in Lincoln to double down on what works to prevent the spread of COVID-19. Now is the time to stay home as much as possible, leaving only if you have to go to work or get groceries, food, or medicine. Now is the time to wear a mask every time you are outside the home, around other people, or in public places. Now is the time to watch your distance and keep 6 feet between yourself and others. And now is the time to wash your hands frequently and to use hand sanitizer when you're unable to wash your hands. Again, we are in a serious situation. We are at a critical point, and what you do right now is critical to the success of our community in navigating this pandemic. Moving on to more positive news, another drive-through career fair was held in 3 locations today. Over 1,000 people participated and were handed a packet of materials with job information, all while remaining seated safely in their vehicles. Job information came from over 50 local employers, from healthcare to manufacturing to construction to administration and beyond. The fair was especially timely for those receiving unemployment benefits who need to participate in a certain amount of reemployment activities per week in order to continue to maintain eligibility for those benefits. We have more information for those seeking jobs on our COVID-19 website on the resident resources page of that website, covid19.lincoln.ne.gov. We also want to remind employers that the Economic Recovery Task Force is seeking your input. The task force has put together a survey regarding the impact of COVID-19 on your business or organization with reference to challenges and opportunities. Your voice is essential to this work, as the results of the survey will help inform the recommendations of the Business Strategies Committee. Survey responses are due by Friday, July 17th, and anonymous submissions are perfectly welcomed. To access the survey, please check out the Business Resources section of our website at covid19.lincoln.ne.gov. Our second bit of positive news today is that this is another Sunshine Tuesday, and we have been sharing art from children each Tuesday as part of the Sunshine Kids for Seniors project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. And since April 6th, about 5,600 pieces of art have been distributed. If your family would like to participate, you may send scanned notes and artwork, just limiting it to first name only on the art, to sunshinekids@lincoln.ne.gov. And finally, we want to make note of a new national ranking for our community. Lincoln has been named the least stressed city in the country from the personal finance website Wallet Hub. And that's some very positive national attention for our great city. At the same time, I think we all know that a lot of people in Lincoln are feeling a lot of stress right now. And many of our fellow residents are struggling to make ends meet and suffering from hunger and illness. The families of the 13 Lincoln residents who have lost family members to the virus continue to grieve. So let's all commit to ask ourselves this question: what can I do to make life in Lincoln better? What can I do to protect my family and my friends and my neighbors? Preventing the spread of COVID-19 must be at the top of the list. And with that, we'll open it up for questions from the media.
Mayor, this is Bill with 1011.
Hi, Bill.
Do you envision a situation if we keep the trend that we're on right now where masks could be mandated in the city of Lincoln?
I've directed the health team to put together their recommendations of any measures they think that will help keep our community safe, and right now all options are on the table, Bill.
I have a question for Scott. This is from Kelsey at NET Radio. With students returning to school, hopefully soon, what are you most concerned about when it comes to college students?
Well, the college student side is, as far as how UNL and Union College and Wesleyan and other branches of things like Doane, et cetera, in our community, we're pretty comfortable with how they're going to handle the classes and the on-campus side of things. The biggest concern is what happens in the evenings or weekends with college students. And it goes back to our concerns that we shared relative to the 20 to 29 age group. The desire to be together, to hang out together, to spend time together, that's a strong pull for college students, and that's probably where we'll have our greatest risk for spread of COVID.
A follow-up is, what steps can college students take to mitigate their risk on campus and in the community?
Well, Mayor pretty much hit that on the head with what they can do. They can wear their mask and keep it on not just when they're going to class, but when they're in their dorms, when they're around other people. They can clearly make sure they try to keep distant from other people. They'll be with a roommate typically, so try to reduce your number of people that you're hanging out with to a very small number, like 4 or 6. And then they can wash their hands and take hand sanitizer with them to various places. And from our preference, for sure, they would not spend time in any larger group setting outside of a classroom.
All right, this question's from Channel 8, and I'm not sure who wants to take this one. Is there a deadline for the recommendations from the health team?
Well, the mayor's given us a deadline, yes, as she typically does. We need to get recommendations to her by this Friday. Okay. Okay.
Any other questions from the media? All right, thank you so much for tuning in. Please listen to these important messages about how we can protect ourselves, our families, our loved ones, our neighbors. We all have a role to play in fighting this virus. I'm confident that people in Lincoln want to do the right thing. We need them to pay attention and do the right thing right now. Thank you.